Namaste, sir. Namaste, everybody. Good afternoon, all of you. I am Dr. Hemant. I am an MBBS doctor. During my MBBS, during my internship, I realized that the non-communicable diseases, the way they are growing and the amount of research that is pouring to discover a single molecule to answer all the problems, it is not bringing any solutions. So I had to make a U-turn there. And I searched all over the country where an MBBS doctor can do an MD in Ayurveda. It was only allowed in BHU, but the competition was very tough. And it was very difficult for me to understand. In my internship, I bought all the Ayurveda books and everything was going above my head. And it was very complex for me to understand. So I thought that let me first begin with yoga and then slowly move towards Ayurveda. It is then that I decided to do MD in yoga and rehabilitation from Swami Vivekananda Yoga University, Bangalore. And there I got interest into yoga research and the lifestyle. And then I found out that there is actually a lot of potential in our traditional systems, which is very much applicable today. And then I did my PhD in yoga and mental health. And over the last decade, this has been the area of my interest. Psychiatry, Ayurveda, yoga, transdiagnostic approaches of how we can understand disorders. So please forgive me, in terms of my Ayurvedic understanding, there are a lot of experts here. I'll just share by whatever I understand. So I offer my greetings from NIMHANS. In 1954, this logo was developed, and here Samatvam Yoga Uchyate was already there. So, there has been a vision that for mental health, yoga is inevitable, and for Samatvam, this is the verse in Bhagavad Gita where Krishna tells Arjuna, Samatvam Yoga Uchyate, Siddhi Asiddhi Samo Bhutva. So that is the approach that we follow. All of you now, clearly understand that these 5 basic elements which are there all around us, they are there within the body also, and the subtler aspect of them are there in the mind also. And Ayurveda and yoga, all these traditional systems are actually about bringing a balance into them. Both these systems are ancient. They find their origins in Veda. Atharva Veda for Ayurveda and Rig Veda mentions yoga for the first time. And these 5 basic elements, if you look at it, the origin of medicine is from Hippocrates. And Hippocrates actually had a humoral theory that was actually based on such fundamental aspects of nature. It was later that the mind and body were split, and then that theory was lost. Still in the Hippocratic oath that modern medicine takes, the humoral theory actually plays a role. So we know now Vata person has earth and water, and typical examples for you to remember, is Atal Bihari Vajpayee ji. We would wait for his next word. What is he going to speak? And a lot of gravity in his speech. Lata Mangeshkar, these are the people, typical Kapha people. I have learnt all this from my guru Kishore ji. Pitta, we know now what Trump is doing to the world. It is not it is Trump, but also there is a lot of Pitta there. So Pitta, if positively channelized, can be very constructive, but otherwise, it can destroy also. So we have the positive construction also we see here. Vata, people walk very fast, they eat very less, they are very impulsive and want to achieve things very fast. So very difficult for them to gain weight. This is typical Vata thing. But as Shetty sir presented very nicely, it matches with my understanding also, that as you age, there is a small baby, chubby baby is Kapha. A young dynamic adult is a Pitta, around 40s. And then later on, as you age, the earth, water in you slowly, is getting withered away and Vata is increasing. That is what we see in dementias also, that slowly the brain, the empty spaces, the ventricles actually is nothing but air. More and more earth and matter of the brain is becoming air. It means the Vata is increasing. So fortunately in traditional texts there is a Vata preventive lifestyle. Can I use that lifestyle to prevent this kind of progression of the disease? This is very, very important aspect. So before we go into that, there have been some wonderful evidences that have come up. This is an indirect evidence that showed that people who had at least done yoga regularly for the past 3 years, and as compared to people who had not done yoga, not that they were completely following an erratic lifestyle, they were doing something else, but they were not doing yoga. It was observed that as you age, the gray matter in the brain naturally shrinks, but this shrinking, the slope was much less steep in the yoga arm as compared to the control arm. So this was statistically significant. Similarly, long-term yoga practitioners have shown enhanced neuroplasticity. And there is, you can see gray matter volume has increased, and this Hari Prasad et al. Is actually an NIMHANS study. Um, Overall, if you look at the scientific evidence, there are 34 neuroimaging studies, and in conclusion, it says that yoga increases regular practice of yoga at least for a year. We were able to demonstrate it within 6 months also. It increases gray matter volume in the brain. So not only that, yoga stops the natural shrinking of the brain, it can increase the volume. Insula is very important area for interoceptive awareness. Hippocampus, we know, is the major organ that shrinks in dementia. So yoga increases hippocampal volume also. Similarly, prefrontal cortices show more activation, and there is functional connectivity in the DMN for health, which yoga has been found. This is the study I was talking about. This study was performed as a randomized control study in old age homes, where people, yoga therapists went to old age homes in Bangalore, took 5 days a week yoga session for them. A scan was done at the baseline and at the end of the study, and we observed that though they were not people with dementia, they were healthy elderly people who showed an increase in the hippocampal volume. This was published in 2013. Similarly, another study showed the autogenic neuromodulation effect of yoga, where Om chanting was able to bring about a deactivation 10 times Om, O and Ma in the ratio 1:2. You chant 10 times, the area of the brain, which is the amygdala, responsible for all negative thinking, anger, aggression, jealousy, that area calms down. And we were also, intrigued by this ancient text known as Mandukya Upanishad, which actually described that the A, U and Ma of Om actually have different consciousness attached to it. A is attached to Jagrata, U to Swapna, and Ma to Nidra. Sushupti and Turiya is the transcendental state. So what we did was, we asked subjects to lie down in a scanner and chant these 3 sounds separately. And we observed that actually, this domains of A, U and Ma is how the psychiatry classifies all the psychiatric illnesses in terms of the externalizing, internalizing, and psychotic disorders. And yoga is about bringing a balance between the 3 and overall balance of the mind. That is how, Krishna in Bhagavad Gita also talks about bringing a balance in recreation, eating, sleep. Then only the yoga can be useful. So we developed a particular task in fMRI where subjects chanted A, U and Ma separately and then A, U, Ma together. And we were actually able to find out that A recruited more attentional networks, whereas the Ma was more into the resting brain area. So therefore, if I am prepared to do certain kind of activity, the A sound comes. Naturally, when you want to do something very intense, like lifting this table, you produce a sound Ah. When you want to think or relax, so there is something in the sound, in the creation of the consciousness that we were able to find out. And there are various brain stimulation techniques that are being used. These are all, we can say, the neuromodulation through external means. But the yogis, ancient yogis, were doing neuromodulation through the mind, body, and breath itself. So yoga can be a non-invasive brain modulation technique for elderlies, and this is the comparison of different TMS, transmagnetic stimulation, direct current, and different yogic postures, how they also indirectly affect the brain in the way the external brain stimulation techniques work. So in fact, the safety of the yoga has been established and it is culturally very acceptable. This is another randomized control trial where we were able to demonstrate that yoga enhanced executive functions in Raven's matrices. Similarly, the quality of sleep in elderly was much better. We were able to show how yoga works in terms of increase in the BDNF levels, brain-derived neurotrophic factor, which is actually responsible for neuroplasticity. It means if the area of the brain is damaged, the other area of the brain can take over the same function, and that improves with yoga. And this was being shown in people with depression also, where actually BDNF goes down. This is a PhD student at NIMHANS. Similarly, there are other studies done by other authors who have shown that yoga practice can be useful in early stages of dementia and MCI as well. Similarly, for ladies during the perimenopausal stage, there are 24 randomized controlled trials. Actually, if you look at the meta-analysis, the confidence interval is quite narrow, and there can be a recommendation that yoga can be used routinely for improving the core strength of the elderly. So these are the 4 asana which I would like to recommend all the people to enhance their core strength, along with very simple practices of alternate nostril breathing and humming or om chanting for 5 minutes daily. So this is what I would like to recommend. Similarly, there are grounding asanas for reducing mood swings in perimenopausal women. Very good effect in our clinics. You can adopt yoga. Yoga is not something very complex. You can adopt all the poses to suit different ages. Trataka, there is another study in International Journal of Yoga where in elderly it enhanced cognition. Only single practice where you keep candle at 1 meter distance in a dark room and keep looking at it without blinking the eyes till the tear rolls down the eyes. So it generally takes 10 to 15 minutes. Very good practice to enhance cognition and quality of sleep. There are different pranayamas and mudras, and of course we know Sanskrit effect, the mantra effect on the brain. We are doing another study where we are assessing the effect of Vedic mantras on the brain in the people who have been chanting them for a long time, and various relaxation techniques. Of course, when you teach yoga to these people, you have to follow certain precautions. Especially, you should be aware of all the comorbidities, and it should be safe. So, first objective is, in over enthusiasm, we should not harm. We see cases who develop back pain or sprain. So, therefore, you have to be very gradual and perform practices under guidance. At the end of it, one question comes: what is the purpose of life? That is what elderly people ask. And yoga is not only about practices. There is very rich philosophy also, where you can use these 4 dimensions of yoga to 4 different kind of personalities. Emotion dominant personality can choose bhakti yoga. Intellectual personality can go to jnana yoga. Willpower dominant people, determined people can go to raj yoga, and people who are workaholic can follow the karma yoga. So Ramana Maharshi asked, who am I? Mahatma Gandhi said, every moment is useful and contributed to the selfless service of the society. Vivekananda was a meditator, and Mirabai devoted everything to God. So this is the lifestyle approach, that actually these are all niyamas, Shauch, Santosha, Swadhyaya, Ishwar, Pranidhana covers in all that. So this can be taken. And overall, this is my last slide. Yoga enhances the well-being by improving mindfulness, calmness, compassion, and sense of connectedness. Connectedness and compassion not only towards others, but I become compassionate on myself. So my relationship with myself improves. That is how the quality of life improves. All the modules and the researches that we have done in the last 2 decades at NIMHANS have been published in this book, which is available in Amazon. And we, at NIMHANS have also been offering free yoga sessions for the elderly, and bringing this connectivity into our yoga sessions. We started during COVID times, but still, these sessions, we see a lot of people who log in and join us. You are also welcome every day in the morning. Sorry, the timing have now changed in the summer. It is 6:30 a.m. to 7 a.m. now. So you are welcome to join tomorrow morning at 6:30 a.m. by this Zoom ID and practice yoga for well-being with us. Very simple yoga, but very effective yoga. So concluding thoughts, this is the time that yoga, the connective power of yoga can be used for elderly, and yoga can be a very useful lifestyle in enhancing the quality of life in the elderly. I acknowledge, our collaborators, our mentors. Thank you very much. Namaste.